In the Western countries, it's not easy to just go to the pharmacy and buy drugs.
When we say substance abuse or even drug abuse, what do you want the ordinary person to understand from that?
Substance abuse has to do with using drugs that have not been prescribed in excess.
Welcome to Noble TV Live with Augustine Omilo. We are discussing the issue of substance abuse, particularly in Nigeria today. And with me to talk about this matter is Mrs. Margaret Anizo, a radiographer. Of course, if you like, say, an experienced medical personnel. You are welcome, Mrs. Anizo.
Thank you.
Yeah, it's a pleasure having you here. Now, when we say substance abuse, or even drug abuse, what do you want the ordinary person to understand from that?
Substance abuse has to do with using drugs that have not been prescribed in excess. Actually, there are drugs that are illicit and drugs that are licit. Illicit drugs are those drugs that by law can be sold and produced and also used. So anything that has not been legally accepted is illicit, and use of those drugs in excess is an abuse.
Okay. Now, when you say a particular drug is not approved, would you want to link it up to what some persons refer to as off-the-counter medicines? That is where you can go to a pharmacy and say, please give me this drug. And those ones that you say that are illicit are the ones that maybe you have to have a prescription from.
Yes.
Okay. Now,
from a doctor.
From a doctor.
Yes.
But, well, I want to ask you now, are there substances that you can mention as an example of illicit drugs or substance abuse? Like maybe you are talking about Indian hemp, or maybe
Indian hemp.
Are there some other ones around?
Yes, there are actually drugs that people are able to get over the counter previously in Nigeria, and sometimes in some localities, maybe in the hinterlands, like tramadol, benylin, codeine, and many other ones that they combine. Especially, they just combine them and take them, and these things have adverse effects on the health of individuals. It can lead to death. They can become addicted to it, and also it can mask other diseases that they are not even aware of. It can lead to mental disorders.
Okay.
Yeah.
That's these substances that are often abused.
Yes.
Okay. Now, but in the event that somebody does not abuse it, for example, now let me take the example of Indian hemp. It's recommended that somebody should take it. Yes. No, is it possible? Because if it's recommended by a doctor, it's no longer a substance abuse because a doctor says you should take it. I mean, it's or even a tramadol now. We have had cases of where they say doctors prescribe it. So when it is prescribed by a doctor, does it still remain an abuse?
Yes, it is. Even if it's prescribed by a doctor, and maybe after use of those drugs, you continue using it.
Okay.
Prescribe it for yourself to use it a second time.
Okay.
While having those same symptoms, it is still an abuse.
Okay, because it's also an abuse.
Yes, it is still an abuse because you may take it in excess. You may not know the dosage that is required for whatever symptoms that you are presently having. So it is still an abuse.
Okay, now we have pharmaceutical companies or outlets, where people go to buy these drugs, and they go there. Like I was discussing off the camera now with Valentine, and he said somebody came to a pharmacy and he was just demanding for such drugs without asking questions. Gives me the drug. What roles are those people who are giving me or giving people those drugs? What roles are they supposed to be playing to ensure that substance abuse is not a thing of continuity in the society?
Actually, in Nigeria, there are regulatory bodies that are supposed to regulate drugs that are out of counter drugs that are sold, and the ones that are supposed to be prescribed. So those bodies regulate what sort of drugs should be readily available. In Nigeria, they have banned several drugs, but it is hard to really bring those laws especially in villages or in communities where those desensitization is not really there for people to know, no, we are not supposed to sell these drugs to individuals.
Okay.
Yeah.
So in which case, even the pharmacists,
they have a part to play.
They have a part to play. And
Yes.
even when they play this wrong part now by selling, so is there anything that anybody can do to actually correct them, you know? Or they just sell anything you like?
No, all of those things has to do with the regulatory bodies.
Okay.
And then some form of sensitization, you know, in schools and various communities like the church, so that people get to know these are drugs that can be easily abused.
Okay.
Yeah.
Okay. Now, looking at the case of Nigeria, compare it with what you have overseas, you know, and see are there kind of similarities or dissimilarities? You can Nigeria, you can go to the as it were now to the pharmacy and buy whatever drug you like, you know, whether regulated or not regulated. But do you do the same if you are in the US or any other country?
In the Western countries, it's not easy to just go to the pharmacy and buy drugs, because those drugs are categorized and there must be prescriptions from doctors before those drugs are sold to individuals. But in Nigeria and in the developing countries, because of this socio-economic condition of the place, many people just they find it easy to buy those drugs. It's cheaper.
Yeah.
They don't need to pay for doctors' consultations. They don't. So the economy also make that people, they easily make the drugs available to people.
Yes, viewers, anywhere you are and everywhere you are, you have had Mrs. Margaret Anizo tell you some things about the drug or substance abuse, particularly in Nigeria, and comparing it with what you have overseas. And she has told you that it is actually deadly to go to the pharmacy and buy drugs that are not off the counter kind of drugs. That is the drugs that are supposed to be prescribed before you buy. And even when it is prescribed for you to buy, after using it and you go back again and buy for yourself because you feel the doctor recommended it before, recommended it for you in the past, it is also wrong, because the issue you may have now may not exactly be the same with why the doctor recommended it in the past. And again, she has also said there is one thing that is actually responsible for people going the way they are going in Nigeria, that is going to the pharmacy to actually obtain that, because of poverty, the economic system that has appeared to stifle everybody, wherein instead of going to the doctor, because you have to pay for consultation, and you now decide to go straight to the pharmacy. And of course, the pharmacy or pharmacists also want to sell, and therefore people are practicing this kind of what if you like medical evil that cannot do anyone any good. And ask her the advantages, and she said there is no advantage as it were, because if you do that which is not medically certified, you are endangering your life. And therefore, recommendation, always seek medical attention before you go buying any drug. And if you are a pharmacist, do that which you can to ensure that nobody just comes to your shop to say, I need this drug, and you dispense without seeking doctor's prescription. On this note, I want to say bye-bye and thank you for viewing until we come again. But then, don't stop at where I stopped. As you have listened, you have to also comment, like, and share. And beyond that, press the notification button so that we don't have to prompt you again. You'll just be getting our discussion by yourself without anybody prompting you. Thank you very much for being there. My name remains Augustine Umilo, and I'll be discussing with Mrs. Margaret Anizo. Thank you for coming.
Thank you so much. Thank you.